Much. Obamacare is driving huge numbers of Americans onto the Medicaid rolls. In fact, the amount dwarfs those using the president's exchanges. Tonight, Chief National Correspondent Jim Engel on what that means for everyone.
The administration has two ways it hopes to reduce the uninsured: signing people up for the exchanges and enrolling people automatically in Medicaid health care for the poor. In fact, officials recently reported 4 times as many people signed up for Medicaid as those who bought coverage on the exchanges.
It's not surprising that a lot more people are willing to sign up for a free Medicaid program than they are to sign up to pay pretty hefty premiums for private insurance plans. And
one consulting firm estimates the number of Medicaid recipients relative to private plans is getting even bigger.
Avalier is estimating that at this point about 800,000 people have or will be enrolled in Medicaid newly, compared to only about 142,000 at this point in exchanges.
The administration expects 9 million to sign up for Medicaid next year, but only 7 million to sign up for private plans. Medicaid, however, only reimburses about 60 cents on the dollar, leaving patients begging for care.
Because a lot of doctors don't take Medicaid, because Medicaid underpays doctors and hospitals to care for patients.
Medicaid is thought of as basically second-class health care. A lot of doctors don't take Medicaid patients because they get reimbursed a fraction of what they would get from a private insurance company for a non-Medicaid patient. So it's hard to get a doctor.
And that will get worse with millions more chasing a limited number of providers.
if you pile, another 9 million people into a Medicaid program that's already stretched, you're going to have a lot more waiting in the future than you even had in the past.
But the private side of Obamacare is also facing a huge crunch because some 5 million whose policies were canceled, in spite of the president's promise everyone could keep their plans, may now be scrambling to find a replacement. That, along with the website delays that left a backlog of people waiting to sign up, prompted the administration to add an extra week of enrollment, moving the deadline from December 15th to December 23rd.
We know that the administration has extended the deadline 8 days in December to allow people, especially those that might have received a cancellation notice, to try and get coverage effective January 1st.
That is also why the administration has not yet begun a full court press to get people to sign up, out of fear the website would be unable to handle the rush. And late today, the administration announced a technical glitch, another one, involving Medicaid applications, which are handled by the states. Washington was not able to send enough information to the states to make full enrollment possible and is now working on what it delicately describes as a transitional fix.
Transitional fix.
A transitional fix.
Thank you, Jim. Appreciate it.